In this video, let's look into a medical condition that can cause a very unusual sign, blue skin. Maybe you have heard of the blue Fugate family of Kentucky. Some of these family members were born with blue skin due to an underlying genetic condition called Methemoglobinemia. Let's look at what this medical condition is and why it would turn your skin blue. If you enjoy exploring interesting medical topics throughout the different ages, then please subscribe to my channel, Doctor of the Ages. The Fugate family of Kentucky were some of the first people to be affected by this condition. Martin Fugate, a French orphan who settled in Kentucky in 1820, was the first known Fugate family member with blue skin. Martin's wife also carried the recessive gene for methemoglobinemia, and although she did not have any signs or symptoms, 4 of their children were born with blue skin. Hereditary methemoglobinemia is typically inherited in an autosomal recessive manner, meaning both parents must carry the gene for the condition to pass down. It is caused by genetic mutations that affect the enzymes responsible for maintaining the balance between hemoglobin and methemoglobin in the blood. Under normal circumstances, hemoglobin in the red blood cells binds oxygen in the lungs and carries it through the bloodstream to tissues. A small amount of hemoglobin naturally becomes oxidized to methemoglobin, but this is usually quickly reduced back to normal hemoglobin by various enzymes. In cases of hereditary methemoglobinemia, genetic mutations impair this reduction process, leading to an accumulation of methemoglobin in the blood, which is unable to carry oxygen efficiently and would give the skin a blue appearance. The symptoms experienced by patients depend on the severity of the condition. So in mild cases, there may be little to no noticeable symptoms, but as the level of methemoglobin increases, symptoms become more apparent. Cyanosis or blue discoloration of the skin is the most characteristic sign, and this discoloration is due to inadequate delivery of oxygen to the tissues. Other symptoms include fatigue, shortness of breath, dizziness, headaches, and in severe cases, confusion, seizures, coma, and even death due to the brain not receiving enough oxygen. Going back to the Fugates, their blue skin really made them stand out in a community where people looked and lived similarly. Their condition wasn't really understood by the public, and not many locals will have an idea about the scientific explanation behind blue skin. As a result, some members of the family were treated as outsiders, and people within the community viewed them with a sense of fear, curiosity, or even superstition. Some people believed that the family might be cursed or had some supernatural origin. This kind of misunderstanding can fuel discrimination and social exclusion, and due to this, the Fugates tended to marry within their own family, which led to genetic inbreeding and actually increased the likelihood of the hereditary condition being passed down. This probably contributed to the family's social stigma, as outsiders would sometimes view the repeated occurrence of the condition as an evidence of abnormal or undesirable family history. There is also a form of this condition which is acquired rather than inherited, and it's caused by exposure to specific chemicals that oxidize hemoglobin. These include certain antibiotics like dapsone, some local anesthetics, and nitrates. Exposure to contaminated drinking water or industrial chemicals can also increase the risk of this condition. The treatment of methemoglobinemia depends on its severity and the underlying cause. In mild to moderate cases, treatment isn't usually necessary, and the condition often resolves without any medical intervention. In some cases, administering oxygen can help relieve symptoms, but this therapy doesn't directly treat the underlying condition. In severe cases, methylene blue is used, which is a medication that helps reduce methemoglobin back to its functional hemoglobin form. In some cases where methylene is contraindicated, high-dose vitamin C can be used as an alternative. Vitamin C acts as a reducing agent to convert methemoglobin back to hemoglobin. In some extreme cases, and when other treatments have failed, a blood transfusion or exchange transfusion might be necessary to remove methemoglobin containing blood and replace it with normal blood. If this condition is due to exposure of drugs, chemicals or toxins, then these agents need to be discontinued immediately. The blue fugates of Kentucky mentioned earlier were known to have a high prevalence of a genetic form of methemoglobinemia, which was likely passed down through generations in an isolated community with a limited gene pool. Their descendants were first treated with methylene blue in 1960 by Dr. Madison Cohen, and the treatment proved successful in restoring the normal colour of their skin, effectively reversing the bluish tint caused by the condition. So there should now be no further blue fugates. I hope you found this video interesting and enjoyed learning about this unique genetic condition. If you did, please do like, share and subscribe to my channel, Doctor of the Ages.